Larry, how is it possible to bypass surgery? Would you be kind enough to demonstrate, first of all, just exactly what is bypass surgery?
Okay, Heidi, it is possible, but let me explain to you how the heart functions first. You know, the heart is a ball of muscle. It just pumps blood and has blood in the chambers, but it needs its own blood supply on the surface of the heart. And that comes in the form of the coronary arteries. And there's one down the front, there's one on the bottom that supplies the right side, and there's one that goes behind the heart.
Now, Larry, the arteries are the red. The red and the blue would be veins?
Veins, because
okay.
Just like every piece of your body, there are veins that bring blood back to the lungs, and there's arteries that bring blood, fresh blood, to the muscle itself. With time, these arteries can become clogged with hardening of the arteries, we call it, or atherosclerosis. And if they become narrowed enough, your heart will not get enough blood during exertion, and you'll start to get a discomfort called angina or angina. And angina is a specific symptom. It's a tightness or a pressure or a squeezing or a heaviness that comes on with exertion. And may go away with rest. And you may feel it in your jaw. You may feel tightness here. You may feel it in your arms, right or left or both, or across your back. Once that occurs, you need to see a physician, and usually we'll do a stress test first to see if that's abnormal. Then we'll do an invasive angiogram where we inject dye into these individual arteries to see if they're blocked.
Wow.
Now, if they are blocked severely enough and we really need to do open heart surgery, it's called coronary bypass surgery. And what that is, the artery, the chest is opened up, a vein is taken from the legs, put into the aorta, and it actually bypasses the blocked piece. So the artery isn't taken out, it's just bypassed. And you can use veins from the legs for some of the arteries. There's also another artery that comes off your collarbone here called the internal mammary artery, and that is also used as a bypass graft.
So this loop right here shows one bypass. If someone had, say, quadruple bypass, would they have 4 of those?
Yeah, you see 4 of these grafts, maybe one to this artery here, one to this one here. And some of the arteries have big side branches that you have to bypass. So even though there's 3 major arteries, each one has a major branch that may require an additional bypass. Now, a lot of times we can fix arteries these days with balloon angioplasty and stenting. There's approximately 500,000 open heart surgeries a year, and there's about 1.3 million balloon angioplasties. And stents, now we tend to put stents in with the balloon, but this is a large balloon, much bigger than the ones we use on the heart, but it can fit into the narrowed area of the heart like that, and we can of the artery. We can expand the balloon, and this is all done through the catheter going through the leg, and it opens up the artery, and then we take the balloon out. And if we want to put a stent in, which we do most of the time when we have, rather than just a balloon, the stent is crimped on top of the balloon, and the stent stays in the artery and expands it.
And keeps it open, is that correct?
Correct?
So, in other words, this represents an artery that looks good.
That looks good.
Okay, and then here we see narrowing.
Narrowing.
From plaque and that. And then this one, you have trouble getting the balloon in.
Yeah, we can get trouble getting the balloon in, but usually we can put the balloon in and open the artery up.
Okay.
Now the problem occurs.
What about, so this one's impossible, which is why we have to come up with another alternative?
Yeah, so this time, sometimes after we put a stent in or balloon angioplasty, years later, the artery scars down and we can't fix it.
Oh, really? So it's not fixed for good?
Yeah, we cannot put a stent in it or a balloon because we can't, there's no opening.
Okay.
Or say they had bypass surgery. Bypass surgery lasts 5 to maybe 15 years. The grafts start to close and the person comes back and they're having angina again. And you have to make a decision. Do you want to do another open heart surgery?
Sure.
Or do you want to try something less invasive? So we may try and do angioplasty, but if the artery is totally blocked, we have somebody who we want to avoid or bypass another bypass. So we do have an alternative to that. And that alternative is called external counterpulsation. It is one of the most bizarre looking treatments that we have. When we go to my office, you'll see how bizarre it is. But the reason why we call it external counterpulsation is because we don't put any IVs in you. It's done in the office. You lay on a bed, which you'll see, and we put these cuffs. There's 3 cuffs. We put one on the calf, one on the thigh, and one on the buttocks. And it's called counterpulsation because it squeezes down when the heart's relaxing. So it pumps blood back to the arteries, and say if this artery, this bypass graft is closed and this artery is blocked, it pumps blood back to the heart and causes new arteries to grow from the open artery here over to the closed one. So it causes the release of these chemicals that cause new arteries to grow. So essentially, you're making your own bypass surgery.
So you're regenerating these arteries.
These arteries.
Huh.
And we're going to go to the office now, and we're going to see what this looks like in a real person.
Oh, boy, I can hardly wait.
This is Mr. McFarland. He had bypass surgery in 1989, almost 20 years ago. About a half a year ago, started having chest pain. We did an angiogram. One of his bypass grafts have closed. Our choices were to do another open heart surgery, which would be an increased risk in him. It would be a second one, or to do this treatment called external counterpulsation. And he underwent treatment. John, why don't you tell us how it felt going through this? Do you feel better or worse?
No, I felt improved quite a bit. My endurance improved.
Your endurance improved. What about your chest discomfort and breathing problems?
The chest discomfort is maybe 90% reduced.
So you think you're back to your usual, almost usual self?
Almost, yes.
So the process is called external counterpulsation. We have these three cuffs here, here, and on the buttocks, and this is going to inflate first, then this one, and it's going to pump blood back to the heart during the resting cycle of the heart, so it's pulsatile. And then they deflate sequentially from here, here, and here when the heart is pumping the blood back away from the lungs. How does that feel to you? Is it not uncomfortable?
It's very normal to me now. I went through it.
You want to do this at home now, right?
Yeah, it's it looks like it'd be uncomfortable, but it really isn't.
And during the time, you were able to read at times, or watch TV, or listen to music.
Read a book, watch TV.
Yeah. So this course is 35 visits, an hour at a time, so 7 weeks, and usually they fall asleep or watch movies. It looks simple, but it's hooked up to this to the EKG machine, and this thing has to pump precisely at the right moment to fill the heart with blood at the exact precise time, otherwise it won't work. And it's caused new arteries to grow from one side of the heart over to another, so he's made his own bypasses. We call it external because everything is external. We don't put any IVs in him, and it's counter pulsation because it's going against the flow of blood towards the heart, and it's a pulsatile, so it means it happens at a certain time in the heart cycle, so we call it external counter pulsation, or ECP. We've done 1,000 patients over the past, since the year 2000. The success rate is about 90-95%, which means 90 to 95% of them get better. And when they do get better, it lasts for at least 3 years or more, sometimes 5 years or more. So we've had a very good success. John is our star patient. He avoided bypass surgery with this, and he liked it so much he came in for another visit today. So Heidi, you've seen how it works in the office. I mean, it's bizarre looking, you have to admit.
It is, and to think that these cuffs do so much work, pumping away and forcing that blood back up into the heart area. How long would the results last, let's say, from this treatment?
Well, the results last about 80% of the people who got better the first time will be still doing well at 4 years.
Oh, really? Well, that's great.
Our success rate is about 90%. So of all the people who come in, 90% get improvement. They get less angina, they get improved exercise ability, they get less shortness of breath. It also improves erectile dysfunction. It also improves blood flow to the liver and pancreas, so your diabetes becomes more easily controlled. And the other nice thing about it is very, very safe. There's almost no downside to it. We check you for an aneurysm down here, which any bulging in the aorta, because that is pumping back towards the heart. We want to make sure there's not an aneurysm that we're going to irritate, and we want to make sure there's no clots in the legs. That may cause a problem, but it's an amazing treatment. It works very, very well. A vast majority of people can bypass another bypass surgery and get I've had patients who could not walk from here to 15 feet without getting chest discomfort, and now can walk miles without having symptoms.
Oh my gosh, that's wonderful.
Yeah, it is.
And when you think that, a bypass surgery itself is 15 years, that you're pretty okay.
Yeah, 5 to 15 years.
This technique really extends the life of a bypass surgery.
Right.
without another surgery.
That's right, and it's it's time out of your day. You have to go 35 visits, an hour a day, so that's 7 weeks, Monday through Friday. But the quality of your life, these are people who have bad hearts. I mean, they've already had surgery, stents. You can't fix things that way, and you can get them back to a normal life. It's very exciting and interesting treatment. We've been doing it for almost 10 years now.
Does it go without saying that if a person is feeling some sort of chest pain, they probably should head to a doctor?
Yeah, they should. And it may not be a pain. It may be just a burning or a tightness or a squeezing or heaviness, shortness of breath with exertion, that's new, jaw tightness, that's new, but they need to get evaluated. Don't think it's indigestion and pass it off.
Well, this was a great and most informative house call. Thank you so very
You're welcome.
much.
Thank you.